awesome intro. Really feeling jazzed to be here this evening, and thank you to all of you for being here. I'll cover a little bit of housekeeping while I'm doing that. Would love, just as a welcoming prompt, just to keep folks engaged. In the chat, tell us about a recent transportation trip that you took that was memorable, and just give us a little background on why that was memorable to you. I'll note that we did this as a panel in our prep session, and we covered, I am pretty certain, every mode that you can think of. We had somebody who had done a scooter share trip, a bike trip, a train trip. Somebody had flown. There was a commute via car as well as walking. So I encourage you to just, as we're sort of getting situated here, we're going to be together for the next about 90 minutes. So it'd be great to get a feel for who's in the room and what a memorable transportation trip was for you. So the way that this will work, again, I'm Nat Gale. I'm the moderator for the session. We will have a short intro presentation from me and then a presentation from each of our three panelists. We'll then open it up for a moderated discussion for about 20 minutes, and then a full Q&A with folks who are in the room here today. So with that, I'll get into just a brief introduction of myself. My name is Nat Gale. I'm the Director of Operations for the City of Hartford here in Connecticut. And what that means is I oversee the City of Hartford's capital improvement program, as well as other interdepartmental initiatives, which is why I'm thrilled to convene this panel of experts to talk about, what it means to center people in our street design. The prompt here is that, over the last, century, essentially, the transportation and traffic profession has centered the automobile as the design vehicle. And so, what happens when we shift that frame to think about streets for people and streets for place? And so our conversation is going to talk about policy, projects, and programs that accomplish that. Before we get into that, I thought it's helpful to just give a little bit of background on me. So I grew up here in Hartford, and as a kid, learning about the history of the city, learning about why things look the way that they do. I learned about the choices that were made in the mid-century to focus on urban renewal and highway construction. Here you see Front Street, what was once a vibrant immigrant community in Hartford that was replaced by Constitution Plaza. And this is one of many stories that we could tell, not just in Hartford but in cities across the U.S. about how our traffic transportation profession centered the vehicle centered did not center people in thinking about projects and programs. And so that really fueled my my career. Prior to moving back here to Hartford, I spent 12 years working in the city of Los Angeles on a variety of programs. One was called the Great Streets Initiative. Many of you, if you joined the morning presentation from Salita Reynolds, she spoke a little bit about this effort to really center people in the design process, in a participatory process, in thinking about how streets and infrastructure can be places for joy, can be places for healthy activity, fun activity. And that meant working closely with community members, working with kids, working with seniors, to think about how the decisions that we make as design professionals, as transportation professionals, can contribute to a sense of place and not just be about moving through a community. And that also led to my education in thinking about how transportation intersects with public health. And about how healthy streets can be places and can be programs that municipalities can contribute to, including to me being right here in the background of this Open Streets Toolkit slide. That's me doing a little hula hoop on a Open Streets study tour. And I can't help but take the opportunity to make a shameless plug for Open Streets here in Hartford. We are developing an Open Streets program that will launch on May 22nd of 2022. So please mark your calendars. We're hoping to create vehicle-free streets for 5 miles of Hartford City streets on 6 Sundays in 2022. And really all of that gets to, sort of the prompt for today. How did we get to the transportation system that we have? And, that starts with a half a century of decisions led by, sort of engineering approaches, standardized approaches to think about how we design our transportation system and our infrastructure. And, I would posit that really the foundation on which this field is built is about controlling individual behavior, right? We have these design manuals, the highway capacity manual and manual on uniform traffic control devices that tell every traffic engineer how to put a stop sign in, how to put a stop light in. That is, again, about the individual's interaction with the built environment. It was this system of control that leads to a lot of the outcomes that we see today, which is a built environment that is essentially designed around that private automobile and how we control and navigate the private automobile in space. In that space is our streets. And so behavior change, right? Individual control of transportation behavior was sort of the reason that this profession came into being. And I would argue that by shifting from designing around this sort of need or want to control individual behavior, and instead thinking about the outcomes that we are trying to design for, thinking about how transportation can contribute to public and community health, thinking about how transportation has to intersect with land use, really setting from the outset what our goals and outcomes for a particular project and program are. And you heard, Salita Reynolds talk a little bit about this in our morning session, that typically transportation and traffic was just about throughput and mobility. But if we broaden our lens to think about community development, economic development, public health, we're going to get different outcomes and different design of the places in which we work. And I think that shift to thinking about the transportation system falls into these 3 buckets. First, the types of policies that will contribute to a sense of place, that will center people in the design process. That then the policy informs projects and programs that actually realize the intent and the outcomes that we are trying to build for, and then working with people throughout that process. This is really how we get to the system design shift, all with equity and underpinning to equity and understanding how to right the wrongs of the past in our design process. And so with those 3 sort of buckets in mind, I'm just overjoyed to present our 3 panelists who are going to tackle each of those individually, and then we'll have a conversation with them as a whole. So first, Garrett Eucalitto, who is a deputy commissioner for CTDOT. He joined the Connecticut Department of Transportation in January of 2020 after previous stints in Washington, D.C. and in Hartford. Most recently, he worked as Transportation Program Director at the National Governors Association in Washington, D.C. Prior to that, he served as Undersecretary for Comprehensive Planning and Intergovernmental Policy at Connecticut's Office of Policy and Management, and also served as a legislative assistant in the U.S. Senate. So thrilled to have Garrett here to talk a little bit about the policy implications of our work. Jim Travers is the Director of Transportation, Mobility, and Parking for the City of Norwalk. Jim brings a wealth of knowledge to the recently created Transportation Division, having served as the Bureau Chief of Transportation, Traffic, and Parking for the City of Stamford. And prior to that, he was the Executive Director of Transportation, Traffic, and Parking for the City of New Haven. So in both of these cities, he has dramatically transformed these areas to address the needs of 2 of the fastest growing municipalities in the state. And noteworthy that Stamford's formerly adopted bicycle and pedestrian plan became the guiding document for improving the roadway for the most vulnerable users. So Jim will talk a little bit about how the policy that Garrett sets at the state has implications on the ground in our localities. And then taking us home, Alycia Santilli is the Director for Community Alliance for Research and Engagement, which is co-housed at the Southern Connecticut State University and the Gale School of Public Health. Building on her work as a community organizer, organizing people to influence state health policy, Her career really explores this critical link between research, policy, and systems change, as well as underpinning all of that is health equity. Alycia has lived in New Haven for 17 years and is an avid bike commuter, and she's going to talk a little bit about how her work at a nonprofit organization intersects with the local and state landscape to produce these sort of people-centered outcomes that I've talked about. So I'm going to stop sharing there and pass it over to Garrett to talk a little bit about what he has been doing at the state level. So Garrett, please take it away.
Hey, thanks, Nat. Let me share my screen. There we go. Okay, so Garrett Eucalitto, Deputy Commissioner here at the Connecticut Department of Transportation. Thanks for joining tonight. Hopefully you're getting to enjoy dinner while you're listening to us. So what I want to use my time this evening to introduce the ConnDOT side of the House is the changes that have occurred in the past couple of years, the current programs we have in place, and some of the major changes that are going to be coming up as a result of the Infrastructure Investment and Jobs Act that was recently signed into law by President Biden. And then I think that'll help inform the conversation that we have, touching on the local level too. So currently at the Connecticut DOT, focusing on non-motorized or vulnerable user front, we have a few different programs currently in place. We have our community connectivity grant program. We have awarded, I think, 90 grants to date in 3 rounds, totaling $30 million, I believe. And it's local grants for localities to make accommodations for bicycle and pedestrian infrastructure in community centers. And the current budget that was just passed last session by the Connecticut General Assembly included ConnDOT's budget requests to make this a permanent program. So we have in the state budget each year for this biennium a dedicated line item to fund the community connectivity grant program, which previously we did not have. We also have our Complete Streets program that's been in place for several years. The previous commissioner put this policy into place. We have a wealth of resources on our website on this topic, and our projects all go through this screening as they come into our building before they're developed. Our Highway Safety Office, when we're thinking about safety for vulnerable users, we have Watch for Me CT in conjunction with the Connecticut Children's Medical Center, a very active campaign out there to try and raise awareness about the needs to pay attention for all users of our transportation system. And with the recent passage last session of a safety bill in the General Assembly, we used some of our funding here at ConnDOT to launch the Pedestrian Rules campaign on TV and social media, on billboards, on buses. So I'd encourage you to go check that out. We have a pretty cool campaign that we whipped together pretty quickly as a result of that legislation. And lastly, our strategic highway safety plan, which is something that our traffic engineering unit has to put together, has adopted Towards Zero Deaths as a programmatic response that was adopted last year, and it's been formally incorporated into the SHSP. So what happened this past legislative session? Well, Major Bill 21-28, Public Act 21-28, created the Vision Zero Council, which I'll talk about in a second. It has a work zone speed camera pilot. It's only for ConnDOT to pilot this in 3 locations in work zones. So we're working pretty mightily hard to try to get that stood up so that we can collect enough data to show the efficacy of using those. It allows for local control of speed limits. So local governments can now request to set and maintain their own speed limits on their local roads, and they can establish pedestrian safety zones, which will allow an even lower speed limit below 25 in those pedestrian safety zones. expands when a driver has to yield to pedestrians in uncontrolled crosswalks, so don't have to actually enter the crosswalk to have a vehicle stop for you. Finally makes dooring an actual infraction in Connecticut, and requires all passengers to have seatbelts worn at all times in the vehicle, not just in the front seat. So on the Connecticut Vision Zero Council side, apologize in advance. We had our meeting today, which conflicted earlier this afternoon for one of our meetings. So we have our next one, January 19th. But it is set up to try and encourage state agencies to work together to come up with a statewide policy to achieve Vision Zero. And as far as we know, it's the only statewide Vision Zero Council in existence. Statute had a few different agencies participating, but allowed CONDOT as the chair to invite other agencies to participate. So we did expand that invitation to try and broaden the scope to maybe some agencies or offices that people didn't necessarily think about. We have public health, we have motor vehicles, State Department of Education, state police, aging and disability services, the traffic safety resource prosecutor in the state's attorney's office, as well as the Office of Early Childhood, trying to make it a really holistic approach to Vision Zero. And our work right now, we just stood up a website today. It's gone live, and you can find it on our CONDOT website. It also allows us to establish committees to help advise the Vision Zero Council. So there is a form on that website, on the Vision Zero website, for people to submit their information, express their interest in serving on a committee. We chose the 5 E's, which you'll see on our website. We expanded the E's beyond the 3 or 4 that are normally on there to also include an equity subcommittee. And that broad group of public members, stakeholders, advocacy organizations can help sit on those committees, advise us as we develop our statewide policy and interagency approach. And lastly, on Infrastructure Investment and Jobs Act, probably one of the worst names for a transportation bill, where we used to have things like ICE-T and Safety Lou, MAP 21, FAST Act, and now we have IJA. It's pretty major changes to our transportation infrastructure program across the country. There is a new Safe Streets and Roads for All program. This is a brand new program. There's a $5 billion over 5 years, and it is a competitive grant program. Local governments, regions, MPOs are eligible to apply, not just for the infrastructure, but also to do planning to develop your own Vision Zero programs in your local governments and in your regions. Just flagging that a local match will be necessary in order to compete for this. So start talking to your mayors and your selectmen, and your board of alders now to start lining up what projects might be of interest in your community. There's also a carbon reduction program. This is a formula program for Connecticut, and it's one of many new formula programs that we are receiving. Also a resilience program, an electric vehicle program, a charging infrastructure program. So carbon reduction program has a lot of vague explanations about what it can be used for. Basically anything that's going to reduce carbon emissions from the transportation system. It's kind of like CMAQ program, congestion mitigation air quality, but kind of not, because there's a little bit broader use there. So we're interested to see what rolls out with that at the federal level. They're codifying the Safe Routes to School program, putting that back into place, and they are requiring each state DOT to have a designated full-time employee working full-time on Safe Routes to School. They're making a lot of changes to the Highway Safety Improvement Program, which is a federal highway plan that each state DOT has to do, and allowing some non-infrastructure uses for those funds, up to 10%. In the Strategic Highway Safety Plan, which I talked about earlier, they're now going to require vulnerable road user safety assessments to be completed. And the last one, our traditional mainstays for a lot of this funding for bike and pedestrian infrastructure, transportation alternatives, and CMAQ, those are now going to see increased funding as well. So there's going to be a lot going on over the next 5 years in Connecticut. All of us at CONDOT are excited to see the regs that are promulgated at the federal level, see the new grant programs that are coming out, and begin to work with our partners at the local level and the public to craft a new capital plan and implement some of these new policy changes. So with that, I will stop the slideshow and turn it back to you, Nat.
Awesome. Thanks, Garrett. For all of you fellow municipal workers, I'm sure you're just already starting to sharpen your pencil, given what Garrett just talked about. A lot of really incredible opportunities from both the federal bill and, seeing how that trickles down to the state, as well as amazing, policy making from the state as well. So thanks, Garrett, for that overview. I am already starting to see some questions come through the chat that we'll tackle once we get through our presentations. And so to cue that up, I'm delighted to introduce Jim Travers, who's going to talk a little bit about his experience taking the policy framework that Garrett just outlined and really, making that, turning that into projects and programs on the ground here in cities and towns in Connecticut. So Jim, the floor is yours.
Thanks, Nat. And it's a big one to follow the Deputy Bishop, so thank you. Let me just share my screen here. Can we see?
Yes, we can.
All right, perfect. All right, so, as Nat talked to earlier, I'm currently the Director of Transportation, Mobility, and Parking for the City of Norwalk. Prior to that, it was the Bureau Chief for the City of Stamford, and then prior to that is New Haven. I think what I was going to talk about today, since my time in Norwalk is relatively short, I've only been here a short while. I wanted to spend a little bit of time talking about some of the results that we saw coming out of Stamford, because I think that they were pretty great. I think when we look at our toolbox, and we talk about our toolbox all the time, right? It's sometimes the basics that we have to remember. It's we can build the best saws, and we could get all the best tools, but a carpenter still uses a hammer to build a house, right? In Stamford, wanted to spend a little bit of time talking about our complete streets philosophy, right? So I had a great opportunity in Stamford to adopt complete streets legislation and a complete streets design manual that you see on the left-hand side of your screen. And that followed up on the work that I was grateful enough to do in New Haven. And I see that Holly Parker is in the audience. So Holly, I think you'll remember some of the work that was on the first screen. And Alycia too. We had a really great time putting together the state's first complete streets legislation. But when we really looked at it in Stamford, really challenging environment, right? We have about 200,000 people, day trips that come into the city every day. It's largely the employment center that happens down. We have the busiest train station in Connecticut. Many people leave the train station by foot, but also many people leave the train station by shuttles because they don't feel comfortable walking the street. We had some really challenges in our infrastructure, right? So it was really about, how do we address some of the safety that occurs on the street? I think the first thing that we really took a look at, and when I interviewed in Stamford, my 5.5-hour interview with Mayor Martin really talked about, our signals are horrible, and we get red lights all the time. He goes, they're perfectly timed. So you get a red light every single signal that you come up to, right? So we took about $1 million city investment, and we retimed all 211 of the city's traffic signals as one of our first steps that we did, and that really produced some incredible results. Right, on here are just two of the roadways, both state roads. Long Ridge Road and High Ridge Road. Seeing High Ridge Road, a tremendous amount of traffic signals on High Ridge Road, congestion, a lot of stores, but really saw a 31% reduction in travel time. I think in the city as a whole, we saw a 14% reduction in travel time. So it was really one of the things that we don't have an opportunity to do on a regular basis. We know that MBTCD recommends that it's done every 3 to 5 years, but it was really the first time that I had the support of an administration to invest nearly $1 million to retime all of the city's traffic signals. And I have to think, it was an incredible result because it really started reducing driver frustration, right? And we retimed it. We looked at, what is the pedestrian phase and, the crossing distance. We looked at, red ball, green ball, and really looked at it holistically in that, incredible results. So I will never underestimate again the power of retiming one's signals, right? Simultaneously, we also undertook an effort to convert all of our signals to concurrent pads, right? So concurrent pads, you go with the flow of traffic, right? And then turning vehicles yield to pedestrians. We did this in order to move traffic. If you've been in downtown Stamford, congestion, right? You're a lower Fairfield County. I think we've mastered the art of congestion down here. But this really started to be able to get people to their destination. And whether you're walking, whether you're biking, whether you're taking a car, right? And then very early on, in a local road accident reduction program grant, thank you, Department of Transportation, right? With Summer Street, we put in a number of pedestrian improvements along Summer Street. It's a busy corridor in the city center. We had a number of pedestrian crashes through the corridor. So there, not only did we do concurrent ped phase, but we also introduced, we were first in the state to introduce LPI, right? Dramatically changed how people felt on the corridor to where we got call outs to people not understanding what we did, but understanding that they felt better, right? So we rapidly started to do that throughout the city and incorporate more of that when we did our signal optimization, right? We also listened to the folks, right? And they felt uncomfortable crossing streets. And one of the things that I, had noticed in, this intersection that we see here on the right-hand side where the new signage, when I first went to the city, we had the old signage on the right, and it reminded me of like cheesy Vegas because it just flashed, red on sides. And then Washington and Tresser, our attempt to fix problems to make people feel better, we kept on putting up signs, right? So there was, we had all these signs of, no turn on, no turn red, and yield to peds and everything, and we just littered them, and so we took them all down. We put out blank out signs, and people started to respond to that they felt better, and so. Blackout signs, I think, are fantastic. These were early adopters of them, so they're more MUTCD compliant as they happen now. But cannot underestimate the value that these blackout signs provided to the pedestrians. In fact, we had other organizations approach us who wanted them by their workforce in their commute to work. Right, RRFBs. We didn't have any in the city. We went pretty rampant with the installation of our RRFBs, really started to make people feel more comfortable. But I think one of the really great accomplishments is to the right is Hawks. So we're the first city in the state to install Hawks, and the cities currently has 5 Hawks in really high pedestrian areas around schools. And really started to, the Hawk that we did in front of Stamford High School was because we lost a child who was going to school to take a test on a Saturday, right? And, so we really started amping up our approach because, when I was in New Haven, we adopted complete streets legislation because we had 2 tragedies on city streets, right? And in a very short period of time. And I think, there are some things that drive us to be reactive and other things that really drive us to, we should look at every opportunity we can so that we're not implementing things simply to respond to. So we really started to amp up what that approach was, right? I think one of the greatest things that we really looked at doing, and this really sits well when you run with concurrent. So on the left-hand side is the intersection of Washington at Tresser, right? And that's actual footage, actual picture, as horrible as it looks, right? And this is the first major intersection that you come to when you're leaving the transportation center, right? And this was the first point of concern that people called out in walking from the transportation center, right? So really what we did was we aligned the intersection. On this plan, we worked, I think John Ghazi is in there. So John, you call out to Fuss, who's been a great partner in this, but it was really aligning the intersection so that the pedestrian remains in a straight shot, because that's where they're walking anyway, right? They're not going around around a corner to walk in a ramp, but we actually installed apex ramps on all the plan is an apex ramps on all corners. We pulled back the center islands a little bit, so you have an uninterrupted walk. And it really, our approach to really moving the pedestrian into the sight line really started to having some really positive effects. And I'm happy at the end of this presentation to start showing you some of the results that we saw there, right? But additionally, it was really, we spent a significant amount of time with some improved pavement markings and implementing 10-foot travel lanes, which, I think for any of our friends who are in municipalities, we all know the challenge that we have in getting boards to approve sometimes 10-foot travel lanes, right? But on here is Summer Street, actual, Google image of Summer Street. And the interesting thing that you're seeing on this one, so it's really difficult to ignore the data, right? So the data, we did not change the speed limit on Summer Street, right? The only things that took place in this were we retimed all the signals on Summer Street and we remarked it. We put in a bike lane, and in some places we got in a buffered bike lane that we're here, and we got in, there's an edge line, where parking was indented a little further, right? But we looked at the prior to doing any improvements, the 3-year average, and that's the before average you see. You see our results in 2018 and then 2019. So it progressively goes down, right? To where we're really seeing some incredible results, right? Including like 9 single vehicle crashes, right? So 9 people going off the roadway, right? To nothing for 2 years in a row, right? So, again, it's some of the basics. It's how we're dividing our road. And, in this instance, Summer Street was really challenging, right? Because we had 11-foot travel lanes and 12-foot travel lanes and 14-foot travel lanes. And I think at one point in time, we had a 15-foot travel lane. It was varied throughout the entire corridor. So we brought 10 consistently throughout the corridor, except when you were around a corner, we did a 10.5. It's like a vertical curve in the road. But in seeing some incredible results in some of the basics that we did there. And then, so Garrett talked about community connectivity. So this is our, Boxer Square, which won AASHTO's Regional America's Transportation Award. So we were really great. You'll see the before picture was on the left, and I can't speak at the end of the day, but interestingly enough, there's a cyclist there. You see, we introduced a cycle lane that comes this way, but we had an old trolley turnaround here, and then we moved it over, gave it a normalized intersection, got better pavement markings throughout the entire corridor, and at the end of the first year saw a 32% reduction in crashes along the corridor, right? And for our bike lanes, when I went to the city, I'm sorry, my lights went off in my office, but okay, there you go. So, when I came to the city, we had 3 miles of marked bike lanes, right? That was it. We had, we created the urban transit way, and that's where we put them. And the rest of the city was littered with sharrows, right? So we just started a process of building them wherever we can. Every time we did a project, we looked at it. We started looking at where pavement markings were in good condition, but we could actually get 10-foot travel lane with 5-foot bike lane, buffering where we can, and then really started to see, a significant increase in bike lanes and a significant increase in bike travel that came across city, right? the results, the interesting thing that'll go. So our total crashes, we had an 8-year low on crashes, right? And really, really pleased with those numbers. You know, we really looked at addressing this through a reactive approach where we took the top 10 crash locations and developed a plan to address each of those, right? You know, and we started to do that, but we also, as you saw in Summer Street, we looked at the results. We knew we were going to go. We looked at getting an analysis before we started work. We looked at a year after, and then 2 years after that to really see if we had sustained changes, and we did. Right, the bike crashes, we had an all-time low. You know, in bike crashes that we had in city. So we've been recording for about 10 years, and we had at an all-time low of bike crashes. And our ped crashes are some of the most things that I'm most proud of, right? Because while we saw a slight uptick in pedestrian crashes, we really saw the severity of those crashes go down, right? And the pedestrian fatalities in 2020 and 2019, we had one. So like, when you're talking about a city center that brings in 200,000 people, as the daily population, and a city that's equal to this, like actually a little larger than New Haven now, as the last census approved, but 8,000 new apartment units that came into the city center. But I think the really interesting thing is when you look at, even with our slight uptick in pedestrian crashes, it did not compare to what we're seeing as a national average in pedestrian crashes. So I think that there are a million things that we can do, but there's sometimes the basics that we have to do because we have to recognize that to be a complete street, we have to take into consideration all components, but it's measuring what those impacts are and to the results, right? So that was it for me. I was really excited to be on here. I want to turn it over to Alycia so that we have an opportunity to get back with you. But thanks everyone for your time.
Awesome. Thank you, Jim. I don't know if there are any other signal nerds on our session today, but I definitely would support a I Heart LPI t-shirt or something. I would wear that proudly. And I think Jim just did an amazing job of covering all the different tools that are available to rethink and redesign our environment. And I think this is a great segue to Alycia. Alycia and I were having a conversation leading up to this panel about the intersection of transportation and public health. And Jim touched upon this. Historically, traditionally in the transportation field, it's been a pretty reactive field in terms of how we think about, plan for, and design safety improvements. Traffic crashes are typically just used in what's called an engineer's warrant analysis to warrant new traffic control devices. And the Vision Zero lens, right, the public health lens, which, at its core, Vision Zero is about thinking about, traffic crashes as a public health epidemic, shifts us from a reactive approach to a proactive approach and looks at a 5-year, crash history to do really an epidemiological analysis of where we see, those traffic crashes, light up like hotspots on the map, so that we can then be proactive and design solutions to meet that need before any, more crashes happen. And, I share that to say, I think it's just, we're so, delighted to have Alycia join us because she comes from the public health field and really brings that lens to think about, how the on the ground work of transportation planning really at its core is about public and community health. And so Alycia, I am just thrilled to turn it over to you to take us home in terms of these presentations before we then open it up for a robust dialogue.
Great, thanks so much, everyone. Thanks for having me today. Really happy to be here and presenting with Jim and Garrett. So my name is Alycia Santilli. I'm the Director of CARE, which is the Community Alliance for Research and Engagement. We are co-housed at the Yale School of Public Health in Southern Connecticut State University. We've been around since 2007. And we are a public health community research center. So we very much bring a public health lens to this work that we're doing. And I'll explain a little bit more about how we got involved in the active transportation work that we're engaged in now and the perspectives that we bring beyond public health. So our mission at CARE is to improve health in New Haven among people most impacted by disparities, including Black and Brown communities and low-income populations through collaborative research, practice, and engagement. So how did we get involved in this active transportation work that we're doing here in New Haven? So at CARE, our public health lens is very much, and specifically, CARE is focused on chronic disease prevention. And the best way to prevent chronic diseases like diabetes, heart disease, high blood pressure, things like that, is through healthy eating and physical activity. And the public health field has really shifted over the past, it depends how you want to count it, but a couple of decades, certainly over the past decade, where we've really gone beyond focusing on individual behavior change, which has been the primary way we've been focused on chronic disease prevention, trying to tell individual people to eat better and get more exercise. We have proven, if we've proven anything in public health, we've proven that that does not work. And so our perspective at CARE has always been around policy, system, and environmental change. So we're really focused on how are our communities set up so that people can engage in healthy behaviors. In terms of nutrition, can they walk down the street and do they have access to healthy, affordable, fresh fruits and vegetables in their community? And can they walk there safely? And so the physical activity lens is really important to us, and focusing on how our communities are set up. So that it's the default option to be able to walk and bike and take the bus places, because that's the best way to get incorporate exercise into your everyday life. So we were very fortunate about in 2018, we got a multi-million-dollar grant from the Centers for Disease Control. It's called REACH, Racial and Ethnic Approaches to Community Health. And REACH is a national program. There's over 30 recipients across the nation, including in Hartford. There's a REACH grant in Hartford as well. So we have some great colleagues up at City Hall doing some similar work. And the REACH grant, fortunately, the CDC has also caught up with this focus around policy, systems, and environmental change. And in with this grant program in particular, there's been a huge shift over, this program has been around for 25 years, and it used to focus on individual behavior change. And now it focuses on those policy, system, and environmental changes that I was referencing earlier. So there's three components: community clinical linkages, nutrition, and physical activity. And very excitingly, so CARE has been working on active transportation related issues in New Haven for most of the time that we've been around. And this was the first opportunity that we had as a public health organization to apply some of that work that we were doing with some actual funding. When the notice of funding opportunity came out from the CDC, and there was this dramatic shift towards policy, system, and environmental change, their main strategy underneath what they were requiring their grantees to do and their applicants to do was to think about active transportation and to think about it from a policy perspective. So this was a really new opportunity for us in New Haven, and particularly within public health in New Haven. And so I called up the director at the time, Doug Houseladen, because he has been, at the forefront of doing a lot of active transportation work in New Haven. And one of the specific activities the CDC was asking for was developing a citywide plan. I said, oh, we're New Haven. We're like so far ahead of the curve. We've got this. So I called up Doug and I said, hey, we have this great opportunity. What else do you need to, want to work on in New Haven? And he said, we actually don't have an active transportation plan for New Haven. We have all these disparate plans and project plans, but nothing that lays out a blueprint for the entire city about how we can improve connectivity through biking, walking, and taking the bus. So it was a really great opportunity for us to partner on this. So we've been working very closely with the transportation department. They have been the lead on developing this active transit plan. And we've worked with street plans. I'm sure many of you are familiar with street plans. They're a national consultant who do a lot of plans like this nationally, and other local organizations like the Safe Coalition. So it's truly been a community collaborative process to get this plan created in New Haven. And I'll tell you a little bit more about what's in the plan and where we are with it in a second. But I wanted to take a moment, getting back to the people component of doing this kind of work, what's really important for us at CARE and the role that we play, we have a long history of community engagement in New Haven, and the perspective that we bring to this work around an active transportation plan is really engaging with the community, again, particularly lower income neighborhoods and communities of color, and ensuring that they have a seat at the table and a say in what goes into this plan. A lot of times, I'm sure, as many of you know, you've been at many of these tables for a long time, I'm sure, these are pretty wonky policy decisions that oftentimes community members aren't really included in. So one role that we've had at CARE is to ensure that we're making a really concentrated effort to get more people at the table having these conversations. Because again, as I'm sure many of you know, you go to any neighborhood meeting in New Haven or your municipality, what are people talking about? What are people complaining about? They're complaining about the conditions of their roads, the conditions of their streets, how, their sidewalks, the pedestrian signals, the red lights, people blowing red lights, the timing not being right. So these are common conversations, but regular folks aren't really being brought into the policy discussions. So that's one role that we've played in terms of getting people at the table. And then the other role that we've played is really focusing on a racial equity lens for the active transportation plan. And I think there is more discussion around bringing in that fifth E that Garrett had referenced earlier. But it hasn't really been a concentrated effort historically that we really focus on equity when we're talking about transportation plans. And historically, we can see how marginalized communities have gotten much less resources in terms of transportation resources. So in fact, one of the things that we really pushed for at CARE with our partnership, and the city was more than open to these discussions, in our active transportation plan, there is a very explicit focus on our priority neighborhoods. So these neighborhoods that are grayed out are neighborhoods that are historically defined as lower income neighborhoods in New Haven. They're predominantly communities of color. And the plan specifically lays out, it prioritizes and puts extra attention on these neighborhoods to ensure that they get the resources that they deserve to get. And not just kind of in here in New Haven, it's typically like East Rock and Westville that get a lot of the bike and pedestrian infrastructure. So really making sure that other neighborhoods get that. So we actually started this process a couple of years ago, but of course we were waylaid by the pandemic, but we've gotten back on track this past year during 2021. And so we've been on a pretty aggressive timeline, well, aggressive in terms of policy development, a pretty aggressive timeline to get this plan developed and passed. So we are nearing the finish line here. And I just put up, some of the work that we've done, and particularly want to point out the multiple opportunities that we've had over the past year for public workshops and public feedback into the plan. So we've taken it really seriously. We've had a series of public forums and different workshops. We've had bike tours and walking surveys where we've collected data with dozens and dozens and dozens of people from across the city to make sure that as many voices as possible are incorporated into the plan. So like I said, we're getting towards the finish line with the plan. We are street plans. We just closed public feedback. We've had it posted for several weeks for our last kind of round of public feedback, and street plans will be taking that feedback and making changes and finalizing the report by the end, the plan by the end of this calendar year. And we hope to get it adopted by the Board of Alders, which is our city council here in New Haven, and hopefully the first quarter of 2022. These are just some examples of the community workshops and forums that we have hosted in New Haven. And then just briefly, you've heard a lot about different types of projects and policies that folks are working on in different parts of the state. So I won't spend too much time here, but did want to highlight what is in the plan document. So it's called Safe Routes for All. It's our citywide plan, and it will be a blueprint for improving infrastructure to support active transportation. And there are three major sections of the plan. There's Walk New Haven, so focused improvements around pedestrian infrastructure throughout the city, again, with that focus on those 6 priority neighborhoods, but it's the citywide plan, so it certainly crosses into other neighborhoods. Ride New Haven is focused on bus stops and bus infrastructure throughout the city so that it's easier for folks to take the bus. And then, of course, Bike New Haven, so really focused on improving bicycle infrastructure. The plan is a combination of looking at past plans and these disparate plans that I referenced earlier, as well as looking at all of the intersections and creating an intersection database for the entire city. Looking at other types of data across the city, we looked at where the highest rates of crashes are, which intersections and streets that have, those things take place on. And so it's really focused on some of those high priority areas. So I'm not sure exactly what's up publicly right now, so I should go back and check, and see what I can share in the chat. But there's a really nicely fleshed out plan. It's, like I said, it's still in draft form and won't be finalized till the end of this calendar year, but we're really excited to be at this point. And the timing is just perfect with the infrastructure funding. Hopefully that will be coming into the state that we have this blueprint ready to roll in New Haven. And that's it from me. I will put my email in the chat and feel free to reach out to me. Be happy to talk about, I am not a transportation or planner in any way. So my perspective is really more public health, community engagement, and health equity. So be happy to talk to anybody about our experience from that perspective. Thanks so much for your time.
Awesome. Thanks, Alycia. Well, I would put you as an expert in understanding the needs of, transportation in the community that you live and work. So really appreciate you, sharing all the good work that you're involved in New Haven. At this point, we've got about 25 minutes, before our session is over and the conference is over. And I will invite all of you, if you have any questions, anything that you heard come up, please drop it in the chat. I've got a list of questions that I'm going to use to sort of moderate the remainder of our discussion. We've got some real in the weeds design-based questions. We've got some policy questions that I'm excited to hear from each of you on. But before I do that, I just wanted to take a moment and acknowledge that we've got the transportation chair, Roland Lamar, Honorable Roland Lamar, in the audience. Really appreciate you being here with us. I would say that, if those of you who don't know him, he's been the driver of some of the most progressive transportation ideas at the state level. And really just wanted to acknowledge your contribution to all of the ideas that we've been talking about here today, and also invite you, if you feel so inclined, to unmute yourself later in our conversation and give us any sort of feedback or perspective that you have on some of the transportation innovations that you're working on at the state. So just really thank you for the work that you've been doing. And I know that it's not just Representative Lamar, but a lot of people on this Zoom have contributed to progressive transportation policy and design in your communities. So really appreciate you all showing up. So building off of Alicia's comments on public health, I'd love Garrett to talk a little bit or hear a little bit from you about this sort of intersection of public health and transportation at a large bureaucratic organization like ConnDOT, right? If you those of you who joined the opening session, you heard Seleta Reynolds talk a little bit about her role in culture change at the Los Angeles Department of Transportation. And, she's been there 7 years and is really only starting to see some of, the shift of the organization's priorities and focus. And so Garrett, I'd love to, just sort of pull on that thread a little bit, specifically through the lens of this question that came through about highway widening, interstate widening. I think that's a pretty, standard, approach from most, state transportation departments to think about, congestion mitigation, through the lens of level of service or, sort of some of these older transportation metrics. And, I'm sure that, you've got a long, hill to climb in moving, that your agency towards some of these newer ways of thinking about transportation metrics, whether that's vehicle miles traveled or, a multimodal level of service. And so I'd love for you to just share a little bit with us about, what culture change looks like at the, Connecticut Department of Transportation and some of the things that, you're excited to be contributing to from your vantage point.
Sure. So start by prefacing it that, we still as an agency are bound by federal regulations and requirements. So, we have to, because most of our program that we implement is supported by federal dollars, it has to adhere to those federal standards. So, we will push our federal partners to, update things. For instance, my colleague and I just recently met with Federal Highway Administrator Stephanie Pollock, acting administrator, and asked her, when can you hurry up and update the METCD? Because there's a lot of potential changes that we'd like to see implemented in there. So that's something that can help unlock some potential. I think you have seen some change here in the DOT. 10 years ago, if you had talked to people in the DOT about doing roundabouts here in Connecticut, you would have been laughed out of the room. But now we have an aggressive campaign here in our state agency to push roundabouts as much as possible to reduce crashes and reduce emissions. We still have to convince the local governments that they're actually good to move forward with. I think the Community Connectivity Grant Program is an example of where there's a lot of focus. We have around 3,200 employees at Connecticut DOT, and they all come to work every day focused on how can we ensure that the users of the system get home safely, no matter how you use our system. So that is our focus. If it wasn't for COVID and other social inequities that we've encountered over the past 2 years, I came into this job in January of 2020, hoping that we would say that traffic violence is a public health crisis and a pandemic in our country. We have two other epidemics, pandemics spreading across our country. So I think traffic violence and deaths on our roads is one of those two. When working in the public health space, prior to joining CONDOT, I worked with the CDC directly, their unintentional injury prevention division, to try and figure out how you could incorporate public health data into your transportation planning. Because for a lot of states, we don't have access to the public health data because it's protected. So we have to find ways to integrate CDC public health data into our crash data repository. Working with UConn, we're signing an MOU with Connecticut Department of Public Health to integrate that data, because while we have the crash data, if someone then goes to the hospital, we don't connect that traffic record to the eventual outcome of that individual in the hospital. So we're not seeing the really true picture of what's happening out there until we can actually get that hospital data integrated, tied to each individual traffic record, so we know the outcome of every single incident on the roadway. That is one of the reasons why I worked with Representative Lamar to make sure that DPH was one of the members of the Vision Zero Council, because they do play a role here. Transportation, we know, contributes to the largest source of greenhouse gas emissions in Connecticut. It is also the major component of in-state produced pollutants. So we're looking at it through the lens of how can we at CONDOT ensure that we increase opportunities for users to not have to be reliant on a vehicle. I grew up in a part of the state up in the northwest corner, where if you wanted to get a job in high school, you had to have a car, or you had to have your parents drive you to your. So my mom would wake up at 4 a.m. and drive me to Dunkin' Donuts for my first job, and then come back later and pick me up until I saved up enough money to buy my first car. So that's where we shouldn't have a vehicle be a barrier of entry into the economy for people. And that's what we want to work towards. I'm hopeful that the infrastructure bill is going to provide that opportunity. We have to work within the box that the federal government gives us, and each box has certain requirements of how those funds can be used. But the good thing is all these new programs, expansion of CMAQ and TA, transportation alternatives, our new funding from the state legislature, it's going to provide us with an opportunity to expand that alternatives on our roadways, but also the transit side. I don't want to lose sight of transit and the importance of transit. And that's where we can have some of the biggest impact on our end, is by pushing more transit, expanding hours of service, expanding the reach of transit, going places we don't go today, and electrifying that system.
Awesome. Thanks, Garrett. Yeah, I just, just for a sense of perspective, right? The city of Hartford on any given day, we've got 5 people working on transportation issues, right? As opposed to 3,200 at the state. And so, a lot easier for us, and folks like Jim, right? In, the sort of local perspective to turn and think, differently and dynamically about, new transportation initiatives. At a large agency, it just takes longer, to turn the orientation. So all the more important why everybody here, your job is to work with your local members, talk to your state representatives, to bring about the change that allows Garrett to continue to, focus on, transportation innovations at the state level. So Jim, I'd love to direct this next question to you. We've had a couple of comments come through about, the sort of nuances of the design difficulties, on the ground implementation of, things like curb ramps, right? The diagonal curb ramp versus the unidirectional curb ramp, or, actually upgrading a, buffered bike lane to a physically protected bike lane, or, some of the trade-offs that you have to make, when it comes to utility relocation, or, some of the nuances that, the average person may not be thinking about when we're thinking about, how we walk or bike or drive through our built environment. So I'd just love to hear from you a little bit about some of the choices that you've had to make, as the lead traffic engineer, lead transportation engineer, in bringing about, a new design approach. What are conversations that you've had with your staff, or you've had in public, with members of the public, to talk about those, trade-offs that are inherent to, rethinking the design of our transportation environment?
Great. So thanks. So I think it's a couple of things that you touched on, and let me see if I can get the best I can. So first off, apex ramps, right? Because it was a big challenge, right? It was a big challenge and a big shift from what we had as what we had shifted to, right? To these directional. And I think we could still look at the TAC pads to give directional. It's just going to be how you're shifting. The TAC pad gets a little bit, takes a few more seconds to shift it, but you could actually get the TAC pads to do it. But what we also did is we did imprinted crosswalks, right? So we added that, and worked very closely with the group in Stanford, which was Access for All, right? And when we installed the first one, there was a call out. There was like, you're pointing me in the middle of the intersection, right? But when they saw the whole thing, and when it comes into play, right? Those, the changes start to become accepted when you get to see the benefit, when you're walking there, and you're, keep in mind that, when you, particularly when you move all your signals to concurrent, right? And now you're walking down the street, and then you're taking a right to get to a directional ramp, right? Then it has the appearance that you're going to be taking a right down the street, when in fact you're going straight. right? So you keep the pedestrian in sight line all the time. And it was one of the things that, what I think the other thing in what we did is we really looked at those intersections and the impact after we did it, right? And the numbers dramatically decreased, right? When we had intersections that had, historically 20 pedestrian crashes, and then those are suddenly 2 years running at single-digit crashes, right? It might not be perfect, but it's working, right? And it's better, right? When we did blank out signs, to Garrett's point, they don't have the ability to, with federal that do it. So we took a little bit of risk, right? It wasn't an MUTCD compliant sign, but you know what? It certainly made people feel better, right? And then that got the attention of DOT traffic, right? We started to look at it and then start to see, find ways that those things are integrated, into the larger picture, right? I think I forget what the other questions that you asked, Nate. Remind me.
Oh, yeah. There's another question about upgrading bicycle lanes from, buffered to protected, and some of the infrastructure trade-offs involved in that.
Yeah. So I think I think there was a couple of things, right? We worked the best to get it in where we could in a budget. I'll keep it. I need to keep in mind, in Stanford we had 3 people, right? We had 24 major construction projects going. We had 50 in the hopper, right? It was, we needed to move the ball. We needed to get it going, and we got it. I think the challenge with, for us in getting, from moving from a buffered bike lane into a protected bike lane was the infrastructure needed to clean, right? We just didn't have the equipment, right? To make sure that the city was able to keep that, clean going forward, right? And that was one of the bigger challenges that came. So what we really looked very heavily on is, can we at least get a buffered bike lane in? And where we can't, let's get it. We looked at introducing green lane markings in some of the key intersections and approaches. We're looking at those similarly now in Norwalk. And included in a community connectivity grant. I'll promote your community connectivity program, Garrett, all night long, right? I think it's been one of the greatest things that we have, right? It allows us quick hits to go after. And I think the issue is sometimes we can't get it perfect, right? But we need just to get it better than where we are right now, and then we can work towards perfection, right? But if we sit there and try to work at everything being perfect, then we're not going to get anything done, right? And when I was in Stanford, we needed to get something done. We were, we had a city of 130,000 people with 200,000 visitors every day. And we had 3 miles of bike lanes, right? There was no bike lanes leading away from the transportation center, which is the second busiest transportation center on the Metro North line, right? So we made it better, right? And I think that I don't think in any project that we did, it was done. Right. I think we would look at how we continue to do it, but we just start getting infrastructure. And I think we listened to people and started making people feel good. And we measure the results, and the results kind of speak for themselves. When you look at where we are, it's really hard to ignore the numbers, right? Because the numbers really work. They're showing that, we're dramatically decreasing our overall crashes. So we're making it safer for every user, right? And then we dramatically decreased bike and ped crash deaths.
Yeah. I appreciate, one of the sort of principles that I practice in my work in government is, don't let the perfect be the enemy of the good.
Yeah.
And on that note, I just want to, something that both Garrett and Jim talked about. Garrett's right. When you have funding flowing to your programs through, federal dollars, there are pretty strict federal, design requirements that you have to follow. And, at the local level, if, your DPW, your traffic division, if they are using local dollars, so long as there is engineering judgment, sound design documentation, you still can encourage your, local municipality to experiment, again, don't let the perfect be the enemy of the good, and try something new that, maybe is an experimentation, but it's soundly documented, it's defensible, it's defendable. And, adding all those different things up, the work that Jim, and folks like him across the state, that then helps sell the case at the, at Garrett's level and at the federal level, so that we can adopt, more progressive design standards. And, these are all things that have to interplay together.
Hey, Nat, can I just add there? So
Please.
Perfect example. So LPI, leading pedestrian interval, that's now, because of what the locals have demonstrated, it's now considered best practice here in our department and being incorporated into all of our projects wherever feasible. In our traffic engineering unit, Mark Carlino, who leads that, is now incorporating LPI and concurrent green. That's going to be all of our projects moving forward. So locals, the laboratory testing and demonstrating it's working, it's saving lives, then we can then incorporate it and roll it out statewide.
Awesome. That's a great example of, how and why it's important to talk to your municipality and encourage them to, keep experimenting. Alycia, I want to, we talked a lot about policy, a lot about projects. I think your, sort of focus on, people and the process is really, an important, central theme. And I'd love to, we've got a lot of practitioners on the call here. I'd love to hear a little bit more from you about methods of community engagement. I think there's, a lot of differing opinions on the best way to talk to people, especially, if you're in a community that maybe is typically left out of a planning process. And, I know there's no one right way, but I'd love if you could, offer some of the things that you've seen, that you've, identified as methods that are helpful in, getting, inviting new people to the table, meeting people where they're at. If you could just talk a little bit about that from your perspective.
Sure, yeah. So, there's no one method. It's always a multitude of methods for reaching community members, because different folks access information about their communities differently. So it's really having a focus on, a variety of methods, from, one-on-one conversations to meetings to social media and other electronic communications like newsletters and emails and things like that. I would say some of our core strategies. So, here in New Haven, we have I'm not sure what other communities are like in terms of your community meeting infrastructure. We have community management teams. And no matter what you're doing in New Haven, that's like always got to be the first thing that you sort of check off, and not just check off, but make sure that you're going to all the community management team meetings to gather input. There are community meetings where people go to get information and to give information about their neighborhoods. So always being on the community management team circuit. So any type of community groups that you have in your own cities and towns, really important to just consistently, and not just going once, but going back continuously with messages and updates about the work that you're doing and gathering people's feedback. We do everything from going to community meetings to literally knocking on doors. And I think that's the value of partnering with a community organization like ours, because, the city doesn't necessarily have the bandwidth to go walk up and down, a bunch of streets in New Haven and hand out flyers and have conversations. But I have a community engagement staff that I can deploy into communities with talking points to really have one-on-one conversations with neighbors and literally knock on doors and hand out flyers. We, as I mentioned earlier in my presentation, we put a lot of focus on hosting community meetings, and I think they're necessary, but they're not the best way to get people who are typically marginalized from these processes at a meeting. It's more important to go into communities and meet people where they're at. So again, going to the groups that are already organized, talking about other community issues, going to the local library, going to the block watch captains, And then, of course, here in New Haven, we have 30 alders on our board of alders. So they are, really represent kind of smaller neighborhoods in New Haven. So getting the word out through our alders is also really important because they're communicating, with their entire constituency. And not only communicating with them, but really getting them on board with what we're trying to do. Other community, and then, we do social media, we have email blasts and newsletters and things like that. And then also relying on other community partners to help get the word out. So not just activating residents, but activating other community organizations around New Haven. Those are some of our main strategies.
Awesome. Love it. Thank you. Okay, so we've got a lot of really, awesome conversation happening in the chat. Everything from, questions about, speed enforcement, automated speed enforcement and red light enforcement that I know today I learned that the state is actually going forward with a pilot in work zones. That's incredible to hear. It is something where we need state legislation in our communities to be able for local communities to actually implement that. So really excited to see the outcomes of that. To this comment about super blocks, I would love to see the first Connecticut municipality to look at a super block design. I know that we also want to leave a little bit of time for some closing remarks from Tony and Charlotte and the organizers for Transport Hartford. So I've got one final prompt that I'm going to ask each of our three panelists to respond to, as well as, please, everybody here, drop your thoughts in the chat. We'll make sure to save the chat. So I'll tell you the prompt before passing it to folks. And that is, we heard, this morning, again, in the opening remarks that, U.S. Department of Transportation at the federal level, Pete Buttigieg, the transportation secretary, has basically carved out some funding for his own special programs, right? That he can, design and implement, in this new infrastructure bill. So my question to everybody here is, if you could give Secretary Pete one piece of advice, one program that you would want him to focus on implementing, and sky's the limit here, right? Could be a super block in every community. Could be mandating, childcare at all transportation public meetings. It could be large or small. What would be the one piece of advice that you would want to give to Secretary Pete? So I'll give the panelists a little bit of time to think about it. We'll go in reverse order. So Alycia, then Jim, then Garrett. And please feel free, everybody else, drop your thoughts on what you would want to, what advice you would want to give Secretary Pete in the chat. And before asking Alycia to speak, I just want to thank everybody for joining us. It's almost 7:30 on a Monday evening before a holiday break. To have had 44 people tune in for this has been a great pleasure, and I think it's just a testament to all of the exciting road, bike paths, sidewalks we have in front of us for progressive transportation here in the Northeast, and it's just been a real joy to be a part of it. So Alycia, I'd love to hear your one piece of advice for Secretary Pete to close us out.
So I think I would encourage Secretary Pete to ensure that there's a health in all policies approach to transportation. So it's something we talk a lot about in public health, particularly as we're trying to do multi-sector and cross-sector work. So no matter what sector you're working in, there's always a public health connection. And so ensuring the health in all policy lens, which includes a health equity lens. So ensuring equity across policies as well.
Awesome. Jim, how about you?
So mine would kind of be copying what we know to already be successful. What we need to get funding into the hands of the people who are doing the projects, right? Let's look at the success that comes out of community connectivity, right? And really count why is that successful, right? Because it gets funding into the hands, very quick turnaround to get to make projects happen, right? federal funding is great, right? But it's also a heck of a lot of a lot of administrative work in managing that, right? And we just need a simplistic way to make funding available so that we can turn projects out. I think in Stanford, when I left, I left 24 active construction projects with 50 in the queue. Those are 50 projects that were ideas that we vetted with the community that didn't have funding for, right? So there's no shortage, and I can come up with 50 projects by the end of business day tomorrow that we can do here, right? I think that is key. We have to find a way to get real money into the hands of cities and towns to make real substantial change, right? We're looking here in Stanford, we have a wildly low walk score, right? When I came to the city, we have behind City Hall, we have a track, right? It doesn't make a difference what time of the day I leave, whether it's day or night. There are people walking around in the track. And when we ask them, why are you walking around the track, after they say, why are you asking me what I'm doing right here? They're walking around the track because they can't walk around their neighborhood because they don't have sidewalks, right? So we have to have massive, and we need a massive amount of funding in order to get caught up, right? So get real money into the hands of the folks who are doing the work.
Awesome. Thanks, Jim. All right, Garrett, take us home.
I'm going to do a warning and a recommendation. So a warning for Secretary Pete would be, I worked on Capitol Hill when we used to have earmarks. I left Capitol Hill in 2013. It's now 2021. There are still unspent earmark funds over a decade old that I worked on and secured for municipalities, and they never spent it. That's the warning. Don't make sure that the projects are at least conceptually able to move forward, and don't start putting money and not have it be spent a decade from now. That's the warning. But what I would like to see is a focus on all users of the transportation system, no matter their level of mobility. Too often we forget about accessibility for all individuals in our state, whatever type of mobility impairment they may have. We need to make sure to accommodate them in all of the programs that USDOT is going to move forward with, and everything that we try to do in our state. That's something that we've been trying to do the past couple of years. We have a new ADA unit here in the department. Some of our legislative proposals we put forward focused on that, and our new IRA program that we just launched to provide vision impaired individuals with access to public transportation. So hopefully that they can do something like that to increase accessibility for all individuals. And I'd love to see them maybe do that through a microtransit program deployed throughout our country. That's it.
Awesome. Well, thank you all. My one piece of advice to Secretary Pete would just make sure that you have a kid test ride your infrastructure. That would be the one thing that I would say. So I know we're coming up on time. I want to pass it back to Tony or Charlotte, to take us through some closing remarks to end the session here. So Tony, Charlotte, I pass it back to one of you.
Yeah, I think Charlotte's got might have something here at the end, but I do just want to thank everyone that participated, our moderators, our speakers, our planning committee, and our sponsors, just for pulling this humongous event together now in our 4th year. Next year, I think I actually did exactly this last year. Fingers crossed, we'll be in person, but it's looking a lot more like that with our tremendous vaccination rate in Connecticut. So keep doing it. Just got my booster. Happy to be boosted. I feel really fast. But stay tuned. We'd love folks to join our Transport Hartford Talking Transportation discussion group. You don't even have to be from the region. We'd love to just hear your ideas. We're learning from folks all over the place. And thank you so much. Thank you, Nat. Thank you, Alycia. Thank you, Garrett. Thank you, Jim. And thank you, Buzz Engine, for running the back end today. And thanks to everybody who tolerated all our hiccups. Tech programs are a challenge sometimes when the gerbils don't all run in the right direction on the internet. So enjoy.
Good evening, everyone. My name is Valerie Fernandez. I got involved in sustainable transportation and environmental justice as a transport rifle ambassador. Now I'm currently a sophomore at the Connecticut State University studying criminology and sociology to become a lawyer. I want to thank you all for attending to our summit. I am so glad that you were able to join us today in this stimulating discussion. Please let's stay in touch. You can sign up for a newsletter, you can attend to our events, and even sponsor or work for us if interested. We hope to see you around.